Hi everyone, welcome back to my channel. This is Darlene with Darlene's Discoveries Through Weight Loss Surgery. I'm so glad you joined me, and I'm so grateful for all of you who have subscribed and followed my journey with me and stuck with me. I sure enjoy watching yours, and I appreciate all that you share. I learn so much, and I uh, enjoy everything that you do. And it's nice to have someone to share this journey with. Let me start out. I had weight loss surgery, vertical sleeve gastrectomy, VSG, in August of 2016. My highest weight was in April of that year. I was 293. And surgery date was, I think, 277. Currently, I'm fluctuating now. As you can tell, my voice isn't well because I've been having issues with my asthma. I'll talk about that more. But anyway, I last had a video in December. I was trying to do, well, I did do wear a dress every day in December for December. And I was starting to get bad then, and I thought I needed to stop, and I did get put on an antibiotic. That helped a little bit, but not very much. I kept getting worse. So I had to do prednisone. My chest hurt so bad I could barely breathe, and I couldn't walk very far without having to take a breath and stop. And anyway, it's just been miserable, and I do tend to get worse this time of year. Um, So that's the pitfalls. Anyway, I forgot where I was going with that. Oh, about videotaping. And so anyway, so I haven't gotten back on because my voice, and it's hard on me to talk very much. It makes it hard to breathe, but I'm wanting to update you, and I really want to finish or get through my format. I'm not sure if I'll be able to do much videoing anymore. My breathing and lung issues are just not very good, and I'm going to talk more about that too. Um, let's see, I have done, this is what I've done so far, so make sure to go back and look at my videos if you would like to learn more information on these. So weight loss surgery and how it relates to breast cancer and how it relates to weight loss surgery, asthma and weight loss surgery, obesity and weight loss surgery, diabetes and weight loss surgery, and I know this one isn't health, but I think it also can affect your health and mental, but relationships, because I've been going through that myself. Anyway, so those are what I've done as things that relate to weight loss surgery. There's a few more that I do want to deal with and share because I think they're important. Osteoarthritis. And these are things that I actually deal with, have with me, and the ones I already do. Something called membranous nephropathy, which is a kidney disease, fibromyalgia, and I do want to do one about high blood pressure. And these are all things that have impacted me. Before I go in today, I want to talk about fibromyalgia and weight loss surgery, but before I do that, I just want to talk a little bit about my current issues going on, because I have done a video about asthma. But my pulmonologist and my asthma doctor both have been trying to treat me and get me over this and get me a better quality of life, and I'm on so many things. But anyway, my pulmonologist said I've done everything I can. I'm going to send you to a ear, nose, throat doctor, and I want to have your heart checked. I did have a CAT scan done last week, and I did see the ear, nose, throat doctor last week, Friday as well. The ear, nose, throat doctor did a scope down to look and see if there was anything to see. And he did say my vocal cords were bowed a little bit. They're supposed to be straight together, and mine were kind of bowed. Anyway, so he looked in there, and it looked like I could be having fungal infection down there. So I am on, I forget what it's called now, what you take for yeast infection. Uh, like if you have thrush or something, or even if you have a vaginal yeast infection or something. So usually what you take one, and if in a few days it's not quite cleared up, you take another one, these little pink pills. Anyway, gosh, what is it called? Anyway, it doesn't matter, I guess. I am taking 2 pink pills a day for 2 weeks. And my pharmacist was like, "Are you supposed to take 2?" I said, "I don't know. I didn't know the dosage. I know it's for 2 weeks. He didn't say how many pills." She says, "Well, I've never heard of anyone having 2 pills a day. Usually the most was to be 1 pill a day." I said, I don't know. It's just what I, so it must be pretty bad. So hopefully that might help my voice anyway. Not that it might help my breathing. Anyway, who knows? He's going to work on me. So I've been there, and my asthma doctor ran a bunch of tests, and he, with blood tests to check all different things, because he's like, we're been trying everything, and you're not getting better. And so he ran a test for what's called alpha-1 antitrypsin. And I know it's a big long word, but it's like it sounds. Anyway, I was very familiar with that. It's alpha-1 antitrypsin deficiency because my son was born with it. He almost didn't survive when he was born. Excuse me. And his affected it's actually called liver lung disease. And his actually affected the liver when he was born, causing cirrhosis. And went through a terrible time when he was first born, and it took a few years for him to even out, but he's been living well and healthy now. Anyway, and they had tested me, of course, and to see, because it's a genetic disease. And at the time, my alpha-1 antitrypsin levels were fine. So, I'm like, okay, I don't have it. Well, that was like almost 30 years ago. And so I don't know why my asthma doctor decided to test that. And I didn't even think to tell him about that because I had not been positive 30 years ago. Well, he tested me, and my alpha-1 antitrypsin is low. What alpha-1 antitrypsin, we all produce that. It helps protect our organs. So if you have an infection or something like that that needs to be fought by your body, then all those things that attack it, your whatever, and attack those bad things. Well, after it gets rid of the bad things, it attacks the rest of you, keeps attacking and causing damage. And like I said, it's a liver lung disease, and depending on where it affects you, it could be your liver or your lungs. I have it in my lungs. So I have this lung disease that has been causing damage to my lungs. Essentially, I'm emphysema. I have never smoked or anything like that, and that's generally, when you think of emphysema, it's from those who have damaged their lungs, like from smoking. Um, mine is by this genetic disease that's passed on. So anyway, they've sent off a test to see where my genetics fall. That determines the treatment. That I can't get any better, and there's no cure for this disease. If they don't do anything, it just progressively will get worse. But they do have where you can have an IV injection once a week of antitrypsin deficiency to add to your body to help keep you from getting worse. So we're looking into that right now, still early stages. Hopefully we can find something to help me, because I've been pretty miserable. Anyway, so on with today's topic. Fibromyalgia. What is fibromyalgia, you ask? Well, I know that I did not know I had fibromyalgia for a long time. I'd suffered with pain a lot from pressure. When I had cats, if they walk across my lap, their feet, because it's a kind of a small spot, it pressures in. Oh my gosh, terrible pain. Anybody would poke me in the ribs, I'm like, oh, it's just, anyway, it's very, very painful. And for those of you who know about it. Let's see, what was I going to read from? See, I found some really good articles, and I'm going to read a little bit from this one. Fibromyalgia is a condition that's typified by chronic and widespread pain, particularly heightened pain that occurs in response to pressure. The causes remain unknown. It's believed it's a result of combination of genetic and environmental factors. Some signs and symptoms: widespread persistent pain, fatigue, trouble focusing, difficulty concentrating, depression, muscle stiffness, sleep disturbances, abdominal cramping, and sensitivity to the skin. Does bariatric surgery help treat fibromyalgia? Yes. Some cases report and studies have found that weight loss surgery has been able to reduce the symptoms and severity of fibromyalgia in certain individuals suffering from obesity or morbid obesity. So anyway, yes, fibromyalgia can be helped by weight loss surgery. Like I say, just went through, I'd been tested and told by doctors before, no, you don't have fibromyalgia. I don't know why you have that one. So I've just been living with it until, 2 or 3 years ago, my doctor, I was like, oh, it just hurt, so he checked my pressure points and all. He said, well, you have fibromyalgia. Okay. And so I have been on Cymbalta for that, and gabapentin, which is for pain. My nephrologist, like I said, I do have a kidney disease. I am not supposed to take any, even before weight loss surgery, I wasn't supposed to really take any NSAIDs or anything. Those damage your kidneys. So I hadn't been able to really take those. So the gabapentin, he said, well, and I was supposed, my doctor had prescribed 3 times a day with that, and my kidney doctor said no, and that's too much. So twice a day, I take it twice a day, and it does a pretty good job. Some days when I'm really kind of hurting, I will take a third one. But those are what I use to treat my fibromyalgia, and ever since that, it's made a world of difference. I did start that before the weight loss surgery. So like I said, it's been more controlled with those medications. I don't know if I've had really a lot of improvement because of weight loss. I would tend to say yes, probably helping me, because I'd been starting treatment about a year before my weight loss surgery. And so I think it's just been a gradual progression of getting better. And so, you know, weight loss surgery definitely helps with so many things and so many options out there to help you. Anyway, if you have any questions or anything about that, please let me know. I'd love to talk with you about it. If you have your story to share about fibromyalgia and how you came to find out about it, please let me know. I love to hear other stories. Um, anyway, I'm going to stop for now. I'm just having a hard time here. And I will keep you posted on what's happening with me as often as I can. I sure love and appreciate you, like I've said. Thank you for your support and for staying in touch with me and keeping me on point. I was going to say my weight, that's what I weighed earlier, has gone up some because of the prednisone. I had gotten down to 204. I am bouncing between 207 and 209 right now. So hopefully I can get back on track now. I finished that a week or so ago, but it takes a little while to get back anyway. So I struggle. In a year, in February, um, I have lost 20 pounds. So I know people say, oh, I'm a slow loser, I'm a slow loser. I don't know anybody who at 6 months, it was about, February last year was 6 months, basically stopped. I was on high doses of prednisone for a few months after that. I didn't really gain, but I didn't ever lose either, and then I've just been slowed down to slower than a snail. But I'll take what I got. I'm grateful for what I've lost and where I am. It's been such a blessing to me. And Amy Eats Plants is doing her Thankful Thursday. I wanted to do that, but um, I'm going to have to try to get those in and do that too, because I have many things to be thankful for. And I am thankful for each and every one of you. Anyway, you guys have a great week. I will talk to you later. Bye.